Harm reduction is a simple concept of minimizing the amount of damage addicts do to themselves and society. Recovery from substance use disorder exists on a spectrum. On one end is the abstinence-only model. A philosophical prescription asserts absolute sobriety for success in recovery from addiction. It's a strict cold turkey approach. It boasts the most desired outcomes for people in recovery and restores them to their pre-addicted self, but with the added wisdom that comes from the journey out of addiction. On the opposite end of the spectrum is the harm reduction model. It accepts many of the harsh realities of addiction and seeks only to mitigate the harm addicts do to themselves and others while stabilizing their use without the expectation of sobriety. A harm reduction method is often the entry point for many people who use drugs and creates a basic structure that will assist them on their path towards recovery, many times shifting towards the other end of the spectrum where total abstinence takes hold. The harm reduction approach takes many different forms, including medication-assisted treatment, abbreviated MAT, such as methadone, naltrexone, and buprenorphine, aka Suboxone. While these programs are typically operated free of cost to the consumer, they can save money in the long run through reduced criminality, resulting in lower incarceration rates among potential drug addicts. These programs effectively drive down criminal activity linked with drug addiction, such as robbery, larceny, fraud, and petty theft, since it's provided free of cost from a clinic. MAT programs also reduce the number of overdose deaths and emergency room admittance. Having recovering addicts stabilize on physician-guided MAT overall reduces the demand for street drugs, which reduces the number of communities saturated with illicit trade. The amount of harm to society that is avoided through MAT programs is largely immeasurable, and these programs have proved an invaluable tool in the push towards recovery, both on the individual level and the societal level. Harm reduction programs like MAT are an important tool in the broader recovery structure. It offers an alternative to the criminalized abstinence-only model and delivers methods to facilitate safer drug use and provide a better quality of life for addicts and the communities they live in. While MAT programs help those seeking an exit from the perilous life of drug addiction, there are very few options to help address the dangers of those currently using street drugs. But there are a few. To the uninformed, some of the current methods of harm reduction seem like enabling or facilitating further drug use. Conservative forces inside the government and the broader culture view criminalizing drug abuse as the only way forward. A full-on war against drugs, and therefore a war on drug users. Put the addict in jail so they cannot do further harm to themselves, ignoring the fact that locking them up is furthering their harm. The criminalized approach has been tried to no success for the better part of 50 years, and many will agree it is an abject failure. Collectively, we've come to learn that we can't charge, jail, shoot, and kill our way out of this problem. Complex societal problems require complex, multifaceted solutions. Within the last 30 years, the medicalized disease model of addiction has come to gain more recognition and support. Addiction is not in the realm of criminology, but should be viewed as a public health issue. Addicts are not immoral, they're sick. The applied science of medicine focuses on outcomes of health. MAT programs are healthier than having someone on street drugs, but if we can't get the addict off street drugs, the only other option is to attenuate the harm the addict does to themselves while in active addiction and keep them healthy until they're ready to engage in treatment and recovery. Intravenous drug users are engaged in the most high-risk behavior in terms of health consequences. They face constant exposure to bloodborne pathogens and bacterial infections, most commonly but not limited to HIV, bloodborne hepatitis, and endocarditis. The best way to combat this is with syringe service programs, most commonly known as needle exchanges. SSPs provide free access to new sterile syringes, which cuts down on the need to reuse and share syringes amongst users. In many areas, especially large metropolitan centers, you cannot buy syringes from a pharmacy without a prescription for insulin. This in turn creates an underground black market for the syringes themselves, which are sold individually for a few dollars each. These syringes are not always clean but may appear unused and sold as such, which can potentially spread more pathogens to unwitting users. Having access to SSPs eliminates this underground trade and ensures safe injection materials for IV drug users. According to the CDC,
New users of SSPs are 5 times more likely to enter drug treatment and almost 3 times more likely to stop using drugs than persons who do not use SSPs. Nearly 30 years of research has shown that SSPs are safe, effective, and cost-saving, and that they do not increase illegal drug use or crime. SSPs that provide naloxone also help decrease opioid overdose deaths. SSPs protect the public and first responders by facilitating the safe disposal of used needles and syringes.
This is not about enabling addicts to more efficiently inject drugs. It's about reducing the spread of viral infections. Most importantly, it's about SSPs drawing in the most vulnerable populations of addicts and having an opportunity to intervene with treatment and other services. Making contact with this population is often the most difficult task for providers. They typically only show up when they're already in crisis of overdose or other medical emergencies. SSPs provide a direct conduit to these addicts on a routine basis. To make a more direct and pragmatic case for SSPs, they save money in terms of healthcare and strain on the system. In a public health report article by the former Surgeon General Jerome Adams, he writes,
"The infectious disease consequences of injection drug use place a heavy toll on entire communities and are a serious threat to the health and well-being of our nation. The estimated cost of providing healthcare services to persons living with chronic HCV infection is $15 billion annually. The average cost of a hepatitis A-related hospitalization in 2016 was $16,610. In 2019, HIV care and treatment cost the U.S. government more than $20 billion. SSPs are associated with an approximately 50% reduction in HIV and HCV incidence. By providing care with a compassionate, non-judgmental approach that caters to the complex psychosocial needs of IV drug users, SSPs serve as a critical and accessible resource."
Every area that has implemented an SSP has seen numerous infections averted and money saved on medical care. According to the CDC, hospitalizations in the U.S. due to substance use-related infections alone cost over $700 million annually. It's clear that SSPs and other harm reduction programs are safe, effective, and provide a valuable resource for the communities in which they're implemented. Abstinence-only programs have an important role in the field of addiction treatment, but abstinence is not a realistic expectation for many people who use drugs. Policy and legislation that pushes for abstinence only is an uneducated and unhelpful approach to the problem of drug addiction. The same people who view harm reduction as enabling simply wish for these societal problems to not exist instead of looking for practical ways to contain the spread of harm caused by these issues. Antiquated ideas of recovery have become intolerant of unorthodox, personalized method of harm reduction, such as moderating or use of less harmful substances such as cannabis or alcohol in place of more harmful substances. What they are doing is making moral statements that have no regard for realistic solutions to the problem. It's a blanket condemnation of the problem with an appeal to dichotomous thinking, black and white thinking. These pervasive societal issues are not black and white. To simply label them as wrong and try to criminalize everything associated with it doesn't do anything to prevent it. It only drives it underground where the problems become more complex and harder to deal with. Condemning the problems of society is performative outrage. The government wants to spend millions on punishment and mere pennies on prevention, and we keep getting the same dismal results. There's never been a drug-free civilization, and it's not necessarily a desirable outcome. It ignores the fact that the vast majority of people who use substances do so in a way that is not problematic, and it brings value to their lives. As for the unfortunate ones that find themselves mired in addiction, they should not have to be held to the often unattainable standard of total sobriety. That is a personal choice. Harm reduction is often an appeal to the lesser of two evils, but it is not a moral question. It's accepting the reality of our cultural issues and making an attempt to fix it.